Hey, what's going on? I'm Dr. Leila Hariri, a family and cosmetic dentist for more than 22 years. And you're listening to Ask Dr. Leila. Anything you need to know about dentistry. We're going to talk about teeth, prevention, oral health, and tons more. So relax, listen, and smile. Welcome to this new episode of our podcast. Autumn is officially kicked off and looking forward to cooler days ahead. I personally love my evening walks, so I really look forward to evening walks when I'm not sweating as much, although the humidity, I keep telling myself, is great for my skin. Hope you're all back safe and sound and the kiddos are in school. Both my boys are back in school. I'm excited. They're in year 11 and year 12. So we're officially kicked off sixth form. Lots of new excitements and stories ahead. Have you guys noticed that we are insisting to take photos of your teeth, especially in big cases where we're doing full mouth reconstruction or smile makeovers? And we know that sometimes we can be annoying, especially when these instruments are pulling your mouth because we need to get, to see completely inside, to get the right views, the right angles. But it's all for a reason. And today's podcast is what are the top reasons why dental photography is essential to the practice and to the patients. The first reason I want to touch upon is diagnosis and treatment planning. Intraoral photographs are an important addition to patient records. So the usual patient records has always been the charting, the x-rays, and study models. That's the basics. And I talked about study models in my first podcast when we discussed veneers. Now, in addition to all of that, we want to add intraoral photography. The next reason that would be beneficial to the patients out there is insurance verification. Many times, periodontal charting, radiographs, or a narrative are required by insurance companies before disbursement of benefits. For example, treatment submission of mucogingival defects, where there is inadequate attached tissue, or frenum pull, is often disputed because radiographs and charting do not show the tissue that we're discussing. But a photograph can be used to support a narrative. Another reason is for specialist consultation and referrals, either within a practice or if you have to refer outside of a practice because that specialist doesn't exist in the practice and the patient needs to be sent somewhere else. Again, charting, radiographs, and written reports were the traditional means by which we introduced our patients to other doctors. Photographs introduce an entirely new dimension to our reports. In the field of oral pathology, for instance, where lesions may present themselves as ambiguous or completely obscure, a complete history accompanied by a high-resolution photograph may be sufficient enough for an over-the-phone consultation with a pathologist. Likewise, at times I receive photographs from referring dentists of mutual patients and their recent surgical sites so that I may assess healing infection without the patient physically present in my office. And just with this past pandemic, this really became handy because this required less time for the patients to actually come in the clinic. And we could have done a certain amount of this stuff over Zoom. Another reason, which pertains to me, is laboratory communication. So this is for my smile makeovers, full mouth cases, full mouth rehabilitation cases. In order to provide optimal aesthetics in a prosthesis, laboratories may require patients themselves to be physically present. A stone model may accurately provide information on tooth position and shape, but it provides no information on tooth or gingival character, the shade, or the color. A shade guide is often used to convey information on color, but falls short in describing the complexity of depth and shadowing a tooth exhibits. A color-corrected photograph can provide much-needed information to create a final restoration with more accurate hue, value, and chroma. My patients have noticed that I not only take photographs before I start my preparations, but also after the preparations. Because after the preparation, the tooth color may change. So I need to convey that message to my lab technician. Another reason is professional advertising and marketing, which is very useful for my colleagues out there and for patients as well. And I'll explain in a moment. Patient before and after photos are powerful images that can motivate and excite patients to pursue a treatment plan. Many times patients ask me, Dr. Leila, can I see some before and after photos of someone that has done something similar to what you're planning to do? And this is very much understood because, of course, before doing any work, they want to see a result on somebody else and see if it's pleasing to their eyes. So this gives them an idea about my techniques and work as a dentist and who I've chosen as my technician to deliver the final results. Many practice websites are plagued with stock images of before and after shots, but they are not original, and it's very obvious that they're just scanned photos. Original photographs better enhance marketing with superior color, accuracy, saturation, sharpness, and high resolution detail. No need to just get photos from the website. Post your own original photos of patients that you have seen and be proud of it. Professional instruction is another reason why photography is important. Text alone is often inadequate in describing dental concepts or specific surgical procedures such as incision design, osteotomy preparation for implant placement, or suturing techniques. A photo is worth 1,000 words and sparks more interest and discussion than bullet points if you happen to be someone who teaches in your field. Nothing speaks to your students as dental photography can, and videography for that matter. Second to the last reason is self-education and improvement. And this is something I highly believe in. I honestly wake up almost every day, I can say, and say to myself, Leila, how can you make a better version of yourself today? And just climb that little insy bit up the ladder. And it's a challenge that I set against my own self. I'm challenging me. So as professionals, we are continually learning throughout our careers. Courses, seminars, and other forms of continuing education are important educational vehicles. But I believe we learn the most from our own experiences. Photographs don't lie. An honest self-assessment helps us to improve the quality of care we provide to our patients. Sometimes with just, a broken tooth, one tooth. After I'm done, I ask my photographer, or I take my own iPhone and I take a photo and I tell the patient, I'm going to zoom in and we're going to look at it together. The more eyes, the merrier. And I try to critique it myself and see if I can find fault. And it really helps me in getting the best end result. And last but not least, treatment philosophy and work ethic is another reason why dental photography should be priority. I encourage my colleagues to photograph every case as if it were going to be published. Minimal blood, minimal saliva, etc. Taking the time to clean surgical sites for photographs requires patience and painstaking attention to detail. I believe this attitude propels you to do the same with your surgeries. Perform and execute at the highest level. We should all do likewise. Practice dentistry as if our daily work were going to be photographed and published in a renowned dental journal, to be viewed and critiqued by our peers. So ask yourself, is my work good enough to be photographed? In conclusion, to all our beautiful patients listening, I hope that now there's a better understanding as to why we take that few minutes, all in all. Sometimes I know it feels longer, but now you know the importance of why we are trying to capture your teeth before we start our case and during and after. As always, any further questions you have, you know you can reach out and ask Dr. Leila through our website, leilahariridentalclinic.com. Wishing you all an amazing day and weekend ahead. See you next time.